Excuse me, ladies and gentlemen, and thank you for your patience in holding. We now have your presenters in conference. Please be aware that each of your lines is in a listen-only mode. You may submit your questions electronically at any time by using the chat pod to the right-hand side of your webinar platform. You may also download a copy of today's slides using the Files pod located directly beneath the slide presentation. It is now my pleasure to introduce Mr. Chris Hunn. Sir, you may begin.
Hello, everybody. Happy holidays. This is Chris Hund, Director of the AHA Team Training Program. Glad to have you all with us here today. Thanks for joining for Taking Steps to Sustain a Just Culture. Just a few rules of engagement as we get into this. So you could access the audio for this webinar in a few different ways. You can do so through your phone by dialing in. That's often the best audio quality we find. But if you do that, please make sure to mute your computer speakers so you don't get any weird feedback. You could also listen through your computer, though. That's totally fine if you have a strong internet connection. We'll have a Q&A session at the end of the presentation, so make sure to chat your questions in as we go. We'll try to answer some as we go, especially if they are of a more logistical nature, but if they are content questions, please chat them in, and we'll have a nice Q&A session at the end. Couple upcoming team training events that we'd love to let you know about. The 2019 AHA Team Training National Conference is in June, the 12th through 14th in San Antonio, Texas. So we're very excited about that. We have a call for proposals open right now for both speakers and poster authors, and that's open until January 4th. So we have a couple more weeks here that you can get in your presentation submissions, what you'd like to talk about. And I really encourage you to do that because in the past, almost everybody that has presented at the conference in some way or the other has been somebody that's come through a course or that's been on a webinar. They're people who are part of the community. So we really like having this feel of it as being a community-run event. So please send in any sort of proposal you might have if you're interested in presenting. And when you're on the website and see our call for proposals, you'll see that we're not focusing specifically on team steps. We're really trying to branch out into all the places that teamwork touch. And so you can kind of tell that today specifically with the fact that we're talking about just culture. So look at it, think about it, pass it on to people that you might know. The conference registration, if you want to attend the conference, that will be open in January as well. Also on our website, we have our TeamSTEPPS Master Training courses that are scheduled throughout 2019. So they are listed on the website, and registration for those will open in January. And last but not least, our next monthly webinar is January 9, and that is the what and why of TeamSTEPPS, a new way to look at the tools and the concepts. So a nice way to kick off the year with some different ways of thinking about TeamSTEPPS. As always, you can contact us via the web, email, or the phone, and we try to get back to you as soon as possible. Of course, with the holiday season coming up, the last week of December will be maybe a little bit more touch and go, but we always try to get back to you within a day. So please get in touch with us if you have any questions. Okay. Today's presenters. Very, very happy to have Lynn Fricke and Ronnie McKinnon, both of them TeamSTEPPS Master Trainers, worked with them for a long time. They are both big, well-known in patient safety and leadership and looking at how it is that you can really take just culture into your organization. So this is going to be, I think, a great presentation for you, a good treat about how it is that you can really affect your culture thinking about teams. So with no further ado, I'm going to turn it over to Lynn.
Okay, thank you, Chris. Before we move on, first of all, I'd like to thank the team, the AHA team, for allowing us to do this presentation. And I guess we need Ronnie to say good morning, good afternoon, good evening, good night, because we have people on from all over the United States. I did say Norway, and Ronnie, we've got people on from your country, Canada.
I saw Quebec. Welcome, everyone.
So what Ronnie and I are going to do is give you our view on how TeamSTEPPS can help you with a particular initiative. In this case, we're talking about just culture. We believe, and just so you know, we are both nurses, but Ronnie is also an attorney. I also have a higher level education in psychology. But our belief is that TeamSTEPPS really can drive almost any initiative, and we hope to demonstrate that for you today using just culture as an exemplar. The two of us have combined, I'm saying, not singularly, over 80 years of experience in healthcare. And I think in our more recent years, our focus for both Ronnie and myself has been on the area of hospital patient safety, teamwork. So just to give you a sense of how the webinar will go, I'm going to give you a quick overview. Ronnie and I have developed a case study. Ronnie will do a polling on that and ask for your input. We will not discuss the results. You'll see the results, but we won't discuss them. We are going to revisit that case study at the end of the presentation and compare results. So that's how we will begin. The other thing I wanted to mention to everybody is how much we appreciate all the questions that have come in. And it's always nice to see what people are really interested in. I have to tell you that some of the questions are very common ones, so I'm going to just take a moment to address a few things and give the short answer. One common question is how we go to the C-suite with any kind of an initiative like Just Culture. And I would say in my experience, and certainly Ronnie, you can, if you have anything to add, it's really about the return on investment for the C-suite. So things in my experience that have worked are bringing forward dollars in terms of medical errors that may have a cost in terms of, for example, a malpractice suit. Let's not forget the cost of training and sustaining staff. So when we go forward, we want to remember to present to them how important it is to retain staff, and that these kinds of initiatives like Just Culture hopefully will support that. And then the other thing is really sometimes just using a particular case that may have occurred, whether it be in your hospital, your healthcare system, in your ambulatory setting, in your office. So I just wanted to get that on board, and I do realize there's much more to that, perhaps a webinar in 2019. The other question that came up regularly I just want to address is about sustainment, which is a very, very big topic. We're going to try to point out sustainment techniques that TeamSTEPPS will provide to get your Just Culture ingrained. But in addition to what we say, I wanted to mention, and Ronnie will speak to this a little bit, is we believe through our own experience that sustainment of any initiative requires people who are masters in the subject matter, and that those masters are at the front line. So I just wanted to answer those two questions. We will try to answer some of the other questions as we go through, and then Chris will have a Q&A at the end. So at this point, I'm going to turn it to you, Ronnie.
Well, thank you, Lynn, and welcome everybody. It's really our pleasure to speak with all of you today about this important topic. And I think and I hope at the conclusion you will see the true synergy that exists between TeamSTEPPS tools and bringing and sustaining a just culture to an organization. So Lynn mentioned a tiny bit about my background, mentioned I was an attorney, and I did serve for approximately 18 years as an in-house counsel attorney for an academic medical center, and in that regard worked very closely with the risk management department, the quality improvement department, and essentially everybody out of the C-suite. And prior to that, I represented healthcare providers, all disciplines, defending them against allegations of medical malpractice. I share that with you as sort of the backdrop as to the experience and that I have had in meeting with, interviewing, taking depositions, if you will, of not only patients and their families, as well as healthcare providers from every discipline after adverse events. And I can tell you that not once did I ever meet a healthcare provider who intended to do harm to a patient. Never once. What I did learn through those meetings, conversations, understanding what happened, how it happened, and importantly, why it happened, I've learned that most of the time these errors have occurred in great part because healthcare providers were really feeling very much about their desire to hurry and help the patient. For example, I felt so hurried to hang the blood because I knew the patient really needed that blood transfusion. I felt that the only way I was going to help this patient who was crashing was to hurry up and draw up that syringe of medicine in order to help the patient. I had no idea that I was making such an error in calculation. So I share this with you because I think through our discussions today, we will see for ourselves that healthcare providers on the front line really are there to do good, to help patients. And all of us can serve a role in terms of improving patient safety. So as Lynn mentioned, we're also going to take a look at this scenario to sort of start us off, to really get us thinking about the reality of healthcare and the delivery of healthcare. We will not, as Lynn mentioned, sort of go over it initially because we want you to kind of keep in mind the scenario as we proceed. But at the end, we will revisit this scenario, and at that point, take a look and see whether our opinions may have changed at all, and perhaps leave us with some additional ideas that we might share in today's conversation. So we have Nurse Smith and Just Culture. Nurse Smith worked in a large non-union hospital. She came in for an extra shift. She had plans to go out with friends, but there were 2 sick calls due to the flu, and her manager asked for help. She told her manager she would come in but needed to leave on time to meet her friends. When she arrived, she was floated to a different unit since she had worked on that unit a few times in the past. Late in her shift, Nurse Smith had 2 admissions arrive from the emergency department at the same time she was trying to get her medication administration completed. She knew hospital policy required a second nurse to independently check and verify high-risk medications, but she was anxious to finish her work and get out on time. Nurse Smith didn't see any other nurses, so she gave a patient a high-risk medication without following the verification process. The patient spit the pill out and stated, "This isn't my medication. I don't take any pill this big. Are you sure you know what you're doing?" At that point, Nurse Smith realized she'd made a medication error. The nurse manager overheard the patient and entered the room. She saw the pill the patient spit out and checked the patient's medication orders. The medication administered was contraindicated for the patient and could have caused a rapid drop in the patient's heart rate, leading to cardiac arrest. Nurse Smith stated, "Well, it was lucky the patient spit it out and nothing happened." So what should happen to Nurse Smith? And here's your chance to take part in our poll. What should happen to Nurse Smith? Should she be terminated immediately? Should she receive suspension without pay? Should she be coached and reminded about risks of workarounds? Should she be consoled about the mistake? There was no negative outcome for the patient. Here's your chance to join our poll. Okay, giving everybody a chance to jump into the poll. Okay, and as we mentioned, we're going to come back to this. We'll talk about this scenario at the conclusion. But at this point, I think we'll move along and we'll get into our topic. And obviously, we all have, we've read the report, the Institute of Medicine report, To Err Is Human. We know about the statistics about patients being harmed as a result of medical error. We also know about the harm that it has caused to patients, to their families, as well as to the other victims, the healthcare providers who were involved in these errors. And we know that the impact of medical error on healthcare providers as well as our patients have significant life, impairing, devastating consequences. Oftentimes, the healthcare providers who are involved in medical errors, they too feel the impact through shame, isolation, and in fact, there's been research and stats that show that oftentimes after one adverse event, due to the stress associated with it, it is it increases the risk that a healthcare provider will be involved in another medical error. So clearly we are aware of the issue as well as the need that we take steps to reduce medical error and to support patients, families, and our healthcare providers through these scenarios and situations. So we have here a very famous a statement by Dr. Lucian Leape, professor of Harvard School of Public Health. In his testimony before Congress on healthcare quality improvement stated, and I quote, "The single greatest impediment to error prevention in the medical industry is that we punish people for making mistakes," end quote. Dr. Lucian Leape, known to all of us as the father of patient safety, if you will, certainly a patient safety champion in terms of understanding the need for a just culture and recognizing that, when we are punishing people for making human error, we are not improving the quality of care. We are not improving safety for patients. In fact, we are probably doing more harm because now, by punishing humans for making errors, we are probably driving the reporting of those errors underground, leaving us with even less information about how and why errors occur.
Ronnie, could I just jump in for a second here?
Please do.
Since a number of people do want to know strategies, I just wanted to mention a strategy here. When we bring this mindset to people, I think when we're trying to teach, it's always good if we have a case study or a video. And I want to give credit to Cleveland Clinic and a particular video they've created and has freely given it out for training. So I think that we can get this put into the chat, the link to it. It's called Just and Fair Culture. Cleveland Clinic developed this, and you can always just type it into your search engine, A Just and Fair Culture by Cleveland Clinic. It's a video, and it's exceptionally well done, and it's quite emotional, and it speaks to Lucian Leape's concepts. So that's just something that if you're looking to bring Just Culture forward and you like to use a video, I wanted to share that. Thank you, Ronnie.
Oh, thank you, Lynn, for sharing that with us. So why Just Culture? And so borrowing here from Don Norman, The Design of Everyday Things, he says, people make errors which lead to accidents. Accidents lead to death. The standard solution is to blame the people involved. If we find out who made the errors and punish them, we solve the problem, right? Well, wrong. The problem is seldom the fault of an individual. More typically, it is the fault of the system. Change the people without changing the system, and the problems will, in fact, continue. And let's sort of think about that point as we move on in today's conversation about Just Culture. Human errors are inevitable. So when we fire people for making a human error, it does not improve the safety of our system, because it's quite likely the next human being put in the same circumstance is quite likely able to make the same exact error. So by, punishing the person does not make this a safer system, but rather redesigning the system is really the approach. And Just Culture really utilizing TeamSTEPPS tools to facilitate it and to sustain it are really a more appropriate approach. In a Just Culture, we more focus and examine the behavior and more specifically the behavioral choices that people make, and look at the reasons why they may have sort of been set up, if you will, to fall into the trap of picking that behavioral choice and making it more difficult for the human to actually make that choice through safety design, through human factors understanding, and through utilizing engineering designs that might actually change the way that we would expect people to respond, how a human being will interact with their environment, anticipating that, and then designing around that, making it impossible, if you will, or nearly impossible for them to make the same kind of mistake. Many of you may remember some years back at the East Coast Hospital, there was a terrible tragic event where oxygen and nitrous oxide lines were mixed up because they both had the same exact connector. Well, firing a person who made that mistake, hooking up the wrong tubing, is not going to make that system safer. The next human being who comes along is going to make that same mistake. The real fix there is not in firing the person involved, but rather redesign the connectors. Make the connectors very distinguished in design so that it is impossible for the human to connect the wrong tubing. So Just Culture, looking at behavioral choices, but also looking at the system and how we design it and how can we improve the designs of it. What is a Just Culture? Well, a Just Culture holds employees accountable for behavioral choices. The employer is accountable as well to design safe systems. It recognizes human error as an inescapable human fallibility, and it abandons this notion of no harm, no foul, replacing it with workplace justice. And, ultimately, Just Culture is about fundamental fairness, reciprocal obligations. Both staff and the organization have this balanced accountability. It sets expectations for safe behavioral choices, and it really focuses on, how can we design our systems that will mitigate, if not prevent, humans from making those errors. This is just an example, and I know you cannot see, and that's quite purposeful, the actual text of this document. This is actually just one example taken from one model of an algorithm to follow for just culture. That model is cited at the bottom of the slide, Outcome Ingenuity. This is the model that I utilized in terms of my Just Culture certification training, but there are others out there as well. And I think, for example, James Reason has the incident decision tree, which is utilized by the National Health Service in the UK, primarily as their approach to responding after an adverse event in terms of how to, in a very balanced way, look at the error and how to respond to the individual or individuals involved in that error. And I think that no matter which algorithm one uses, it aligns with some high reliability principles in that it really is about a reluctance to simplify. If we follow an algorithm, it is inherently fair, it's objective, it's being evenly applied, fundamental fairness to all, rather than jumping to a conclusion, a knee-jerk reaction based on the outcome. And so this is something that I want to share with you just to sort of as an example of one of many of the models that an organization could adopt. But again, I want to follow up on something that Lynn mentioned earlier in terms of utilizing masters in the subject matter. While, we can't all be masters at everything, I think it's very important to defer to expertise, another high reliability organization principle. And by bringing in those masters, bringing in the expertise in terms of training the trainer, cascade learning, and bringing them, to the table along with frontline staff to understand and master the principles of just culture so that algorithms such as this, algorithms such as the James Reason's incident decision tree could be applied in a very organized, methodical, and fair way. Some of the benefits of just culture, well, they'll reduce behavioral and system risks. It will create an open, fair, and just culture, a safety culture. It creates a learning culture because mistakes are, in fact, learning opportunities. Again, another concept aligned with high reliability, creating a learning culture, utilizing the mistakes and the errors as opportunities to understand how and why they happen so that we can learn from them. It gives insight into how these errors occur so that we can, in fact, design safer systems. And it helps us then manage these behavioral choices by reducing the risks of workarounds and drift. And when I use that term drift, I mean where staff are drifting away from established policy and procedure. And I have found through the interviews and conversations with individuals involved in medical errors that oftentimes it wasn't just the one person who had drifted from the policy, but rather I find that drift is a very contagious thing and that it tends to spread throughout a unit very quickly. You might hear things like, oh, this is how we do it here. That's a signal in terms of an entire unit normalizing a variation, that they have drifted away from a policy and procedure, creating their own workaround. The problem with that is staff sometimes doesn't understand, many of us fail to understand, that when we take away certain steps within a policy or procedure, we're actually taking away the safety net that prevents that error from reaching the patient. Some key components of just culture. Now, what we've tried to do is kind of create in this one slide, the three behaviors in one particular model of a just culture. And they look at three behaviors for analysis. Human error. which is that inadvertent error, a slip, a lapse, a mistake. And those are the things that, all of our human factors that we're aware of sort of, play a very big part into creating our human error. Sound alike medications, look alike, mishearing, just the human factors involved in causing a human error. At-risk behavior, behavioral choice increases risk where risk is not recognized or mistakenly justified. And reckless behavior, a behavioral choice to consciously disregard a substantial and unjustifiable risk. All right, I will say that in my experience, I have found the at-risk behavior is the behavior that I had most frequently seen in terms of adverse events in both medical malpractice cases, adverse events involved in complaints, lawsuits, regulatory compliance issues. And it is really the failure to recognize the risk or the mistaken justification in taking the risk played a very large part of an individual's decision to carry out a workaround, a shortcut, not following a policy procedure. They just didn't see the risk that was involved in that behavioral choice, or they felt really justified in taking that risk. Take us back to the, I thought the patient needed the blood so badly, that's why I didn't bother with the second nurse verifying. So these are the kinds of things that I have seen personally. You all might, have your own stories about just this. And the reckless behavior is really, in my personal experience, the least likely times that I have seen these adverse events. More frequently, the human error and the at-risk behavior. Although I will tell you that there is often disagreement when we analyze these events and the behavioral choices on whether it's at-risk behavior or reckless behavior. And even within trained masters in the field, there could be some disagreement in terms of what behavioral choice it really was. And what are the key components of just culture as it relates to the response to the behavioral choice? Well, in a just culture for human error, we console the individual or individuals. And importantly, it does not stop there. We look at the system and see where can we redesign the system to prevent the next human being from not making that same human error. And then at-risk behavior, we would respond in a just culture by coaching. Coaching for what? Well, coaching to make safer behavioral choices. And this is a really big part of just culture, the coaching aspect. Because again, this is the bulk of what I have seen in my personal experience, the at-risk behavior that in a just culture we would want to coach them back to safer behavioral choices. Part of that coaching is to help people understand the risk. What is the risk associated with making that unsafe choice versus the safer choice, as well as understanding that there is not necessarily a justification to taking that risk. In a just culture, we would reserve discipline to behavioral choices of reckless behavior. So it's going to be probably, a much lesser response in terms of volume, all right? What we see more frequently is the at-risk behavior that we would really want to try to coach them back to safer choices, but we do reserve discipline for reckless behavior. Just culture defeats outcome bias. We have to have a conversation here about outcome or severity bias. Traditionally in healthcare, we tended in the past, I remember as an early fresh out of nursing school nurse, it seemed when there was a medical error, no matter, whether it was human error, at-risk behavior, or rarely reckless, based on the outcome, that would be the decision made on how to treat, the individual. And that does not make a safer system, all right? When we terminate someone who made a human error, the next human being is likely going to make the same human error. So we are not improving the system. What is outcome or severity bias? Well, the severity or outcome of the event plays a role in choosing how to respond to the event. The outcome dictates the response. This does nothing to improve patient safety or a culture of safety. This is not just culture, all right? Because also, if we are not responding to the behavioral choice will repeat, and the next time that unsafe behavior is selected, we may not be as lucky, and we may have a really bad outcome. In a just culture, responses to events are not based on the outcome or the severity, but rather are based on the behavioral choice of the individual and the contributing factors of the system, not on the severity of the result. Because remember, if we did not have a severe outcome, but somebody made a really reckless behavioral choice, it was pure luck that nothing bad happened. And luck is not a patient safety plan. At this point, I am going to hand off to Lynn, who will, help us see the synergy between Just Culture and TeamSTEPPS tools.
Thanks, Ronnie. And I just want to say that to reiterate something Ronnie spoke to earlier, having masters in Just Culture, and there are questions coming in. Hopefully we will be able to answer those at the end of the presentation. But Just Culture is a very in-depth subject, but I just want to say I think Ronnie gave us some very concrete steps and simple ways to think about Just Culture. And my piece is going to be how to take the Just Culture and introduce it and sustain it with your staff with TeamSTEPPS. And I'm going to start by simply asking you all, is there anyone on the line who doesn't feel they have multiple initiatives? I think if we look at the bricks, that we know that we could fill in every single brick with an initiative, and that grows, and as we move forward, change is always in healthcare. So what we are looking to do is take our initiatives, like Just Culture and many others, and make sure we have a mechanism to instill them in people and sustain them. And that's a true challenge, because this is what we really need to deal with. And I just put these in right off the top of my head. I imagine those of you on the line can see that these are things we're all dealing with, and we have many, many more. But as we build our foundation, and as we build the strength of our healthcare systems and our practices and our ambulatory areas, we know that we have to bring forward all of these and really solidify them. So the question is, how do we do that, and how do we prevent this, where things are aligned and seem to be solidified together, into turning into this? And that's a challenge. So I pose the question to all of you. Is TeamSTEPPS another brick or another initiative, or is it how we bind everything? So if we just take a quick look back at that slide that I showed you, I just want to jump back. I don't have TeamSTEPPS in here. I have TeamSTEPPS in here. And Ronnie and I talked about this at length, because in our experience, we have found that TeamSTEPPS allows us to introduce, deliver, and sustain any number of initiatives. And now I'm going to try to walk you through how we would see this working with Just Culture in your organization. So, the very famous slide, anybody who's been trained in TeamSTEPPS, particularly any master trainers, knows here are our tool and strategies. I'm not going to spend time going through each of them, but when I pick and choose different tools and strategies to illustrate how they support Just Culture, I will reference and give a little bit of an explanation. Because our steps here are building the wall to sustain the Just Culture. How do we begin? Well, if you're introducing Just Culture, the first thing you have to do is train your staff. And I think Ronnie really did a good job at explaining the importance of having those people with the master skills and training. But what happens after you train your master trainers, or you use a train-the-train model, or you have classes? Here's the question to think about. Once people walk away from training, do you know if they really understand Just Culture? Because I think in listening to Ronnie, we know that things are very easily misinterpreted, and there may not always be a solid answer. But the thing we don't want to have happen is have people walking away with a misconception of what Just Culture is. So what do we need? Well, in TeamSTEPPS, we always talk about creating a shared mental model. What shared mental model do we want here? We want the shared mental model that the organization believes in Just Culture. We want the shared model on what those behaviors look like, what the responses look like. And we also want our staff to understand that Just Culture is not a situation where we have absolutely no accountability. And I can speak as I was a manager for many years of a critical care unit, and sometimes we talked in terms of Just Culture. Sometimes we talked about non-punitive response, because anybody who uses the hospital survey on patient safety, the HSOPs, knows that there is a question on non-punitive response. And a lot of times people would respond by saying, oh, I thought we had a Just Culture. Oh, I thought that we didn't punish in this organization. So it's important they understand that while the organization will look at all aspects, look at behavior, look at their own institution as contributing to certain outcomes, it doesn't mean that we don't still hold people accountable for their behavior. Once you've established a shared mental model, and to the people who ask about sustainability, I think check back in the times that the opportunities present themselves is a wonderful TeamSTEPPS tool. When we learn it, often the exemplar that's given is, oh, we're in a code situation, the doctor asks for a medication, the nurse repeats it, and then he confirms, or an order over the phone, or something like that. But, you know, we're looking at different ways to use TeamSTEPPS. So if you've got a staff and they have that shared mental model, I think we all know over time people can forget what or misconstrue what something is. So here's a strategy, when you have the opportunity to bring it back to the table. For example, if you're in a debrief discussing something that could have gone better, if there is a medical error, if there is an RCA, it's an opportunity to use a check back to examine whether or not the staff can verbalize and appreciate what is Just Culture. Because once we get to the point where we believe in Just Culture, but the staff misinterprets it, we can lose it very quickly. And we can wind up with people really being angry at the system. And I know there have been situations in my own experience working with teams where people have said, how can we say that there's a Just Culture non-punitive because I got written up? And we don't want that to happen. We want people to understand truly what Ronnie explained to us. Ronnie, I don't know if you want to add anything there. I know that we both feel very strongly about this.
No,
Ronnie?
I'm here. I think you nailed it. We have to have a shared mental model, and there has to be a continuous, feedback, check back in terms of making sure people fully understand it. I don't want to say too much more because I know we have some time constraints.
Well, I think the important thing is that we remember that we have to be relentless. If you think back to TeamSTEPPS training and Cotter's model, we have to be relentless. We can't declare, victory too soon, but the fact is we know we have to, if you want to sustain, you have to have this brought back over and over and over again, whether it be through leadership or peers who are champions in this. I've worked in a very large health system, and they did a great job with TeamSTEPPS captains or coaches that were staff that could kind of bring it forward peer-to-peer. I know people have asked about peer-to-peer, and I think it's really that you need leadership to staff and peer-to-peer. Ronnie and I have, on many occasions, discussed how situation monitoring totally is cohesive with a just culture. Now, when we think of the tool of situation monitoring, we know it begins with our own awareness of ourselves and our behaviors, and then that being shared. And we share that at different times. But think about how important being able to watch each other and speak up is to sustaining a just culture. Because in a just culture, we want people to feel that they can speak up. It's not a blame game. We're looking at behaviors. We recognize, referencing back to something Ronnie said earlier, when we look at high reliability, we know we don't want in a highly reliable organization to take one simple answer. We want to look at all the factors. How do we know all the factors if we don't have situation monitoring? And if you go way back to TeamSTEPPS 1.0 from AHRQ, you probably remember cross monitoring, and it did come up again, but it wasn't, I don't think it was on the slides. But cross monitoring is a piece of situation monitoring, which is really like having a buddy, having your back. So if you think back to what we had looked at when we looked at Nurse Smith, think about what happened. She came in on a day off. She was floated, and any nurses on the line know how that feels. But there was nothing happening to really provide her a cross monitoring. So think about what would have happened if they had a brief in the morning, and this is something I used to do as a manager. And when someone floated, first they got kudos and were made to feel part of the team, and they got a buddy. And the buddy was there for them to go to, and for also some cross-monitoring because they maybe were in unfamiliar territory, so to speak. So cross-monitoring could be a very, very powerful tool to utilize in a just culture situation to make sure that we're watching each other and speaking up, and hopefully if we see the shift before it gets to a reckless behavior, the shifting that Ronnie was talking about, we move forward. And that would lead to task assistance. And when we learn about task assistance in TeamSTEPPS, two components. One, we have to be able to ask for help. And two, we have to be willing to give help. And again, I draw you back to that model of poor Nurse Smith there, who did engage in behavior that was inappropriate. But again, if she had had an opportunity, if she knew who to go to, perhaps she might have asked for some help. There was a point there that she should have. Clearly, she needed assistance. She had two patients come at one time. She had medication, and, there was no request on her part, but maybe she didn't know who to go to, or maybe she was embarrassed to ask for the help. So task assistance is a very key factor. And most importantly, I think, is developing just culture and feedback go hand in hand. Again, to those of you questioning about peer-to-peer, yes, peer-to-peer, but also leadership to peer. That means that leadership has to be able to set a tone where they encourage feedback. They don't just deliver feedback. Often, when I've trained people, and I've trained people from around the country and out of the country, people think feedback means that the boss is going to tell you something. We want to get our staff comfortable with giving feedback to each other as well. And yes, the feedback has to be respectful and at the appropriate time and very specific. We know all this from TeamSTEPPS training, but the feedback should be very specific and it should be given freely. And that's something in leadership you can train your staff. Some of the pitfalls we fall into is sometimes we have an opportunity to give feedback in a debrief. A debrief is a wonderful place for feedback. Briefs, huddles, debriefs, but particularly debriefs because we talk about what did we as a team do well, what did we as a team think we could do better, what do we want to change. But I tell people, if you're leading the debrief, and particularly if you're in a leadership position, remember your ABCs and remember your 1, 2, 3s. The ABC is ask before you coach an answer out of someone. And that might mean that you ask everybody to give you some response, because when you debrief, there are people who will speak up, and you have to provide and almost create the opportunity. And I know as a person who's been in a leadership situation, it's not uncommon for someone to ask and answer the question. So ask before you coach the answer and count. I always say give them 15 seconds, and it's longer than you think, to answer. And the other thing is to be awesome. At the end of your debrief, always give one more chance for feedback by saying, or, and what else. So use those debriefs. It's a wonderful opportunity for feedback and for us to look at behaviors and then reinforce and maybe do a check back on how the staff sees this fitting in to just culture. So at this point, I want you to remember and emphasize, and this really is something that I think Ronnie is very passionate about, you can't just teach just culture any more than you can just teach TeamSTEPPS. It really comes into coaching it. And the coaching doesn't come from an office or the C-suite. The coaching comes in real time. And I hope we've been able to give you a summary of what just culture is and also show you how TeamSTEPPS, if you think about the tools, if you sit down, and we used a few, we could probably come up with other TeamSTEPPS tools that would help you with just culture. They really can go hand in hand. But I want you to remember that brick wall. That brick wall had a lot more than just culture. We believe that TeamSTEPPS can truly help you through all those initiatives. So at this point, I think we're going to ask you to take a moment, correct, Ronnie, just to reread. This is the same scenario. And Ronnie, go ahead.
So we're back to the same scenario, and Nurse Smith, we have not changed a thing. And we have a poll.
So we just want everybody.
Once again, here's the poll. What should happen to Nurse Smith? Should she be terminated immediately? Should she receive suspension without pay for 2 weeks? Should she be coached and reminded about the risks of workaround? Should she be consoled about the mistakes since there was no negative outcome for this patient? We're giving everybody a chance to join in on the follow-up poll.
And I think Jenna is going to put up the two polls side by side.
Right. So let's see if we can take a look at them. I'm just scrolling down to take a peek. So in our first poll, before we really began our conversation here today about just culture, it looks like we had a 0 response to immediate termination in the pre-poll. We'll call it the pre and the post. We had a 1.92% response of suspension without pay for 2 weeks. We had a 96.6% response pre-poll that she should be coached and reminded of risks. We had a 1.44% response rate about being consoled since there was no negative outcome to the patient. Compared to our post-poll, it looks like we have, I'm just trying to scroll up and down so I can see them myself side by side. In our post-poll, it looks like our terminate immediately response dropped from 1.9.2% to 0.47. We have a slight decrease post-poll of suspension without pay, went from 1.92% to 1.42%. We had a slight decrease in the coach and remind from pre-poll. Pre it was 96.6, post-poll 91.4%, and our pre-poll, post-poll differentiation, pre-poll 1.44% said she should be consoled, there was no negative outcome, went to 6.64%, she should be consoled, there was no negative outcome. So there's our pre-post poll. That's kind of interesting to me.
Yes, I think, and we want to ask one more question, and then we want to turn this over to Chris for the Q&A. I think that this is the second polling question, so if you could just respond to this, and if you think that in answering this, you answer yes, I think TeamSTEPPS could help. If you want to type in chat, because we like to learn too, we want to know, would you agree with the TeamSTEPPS tools that we recommended? Would you use others? Do you see this as something you could use in Just Culture, other initiatives? We'd love some feedback from you.
We're giving attendees a chance to type in some ideas they might have, what TeamSTEPPS tools they think might have helped not only prevent this error, but also, introduce, facilitate, and sustain just culture.
While people are chatting in some of their ideas, I think one of the important things to think about when you're considering TeamSTEPPS to support maybe just culture or to be that mortar for any of the bricks in the wall is that people don't need to go through, they don't need a huge training program, they don't need a PowerPoint presentation or a memo or something. A lot of the TeamSTEPPS tools can be taught very briefly without people feeling that they are in the middle of another initiative. So that's a really good point that you guys brought up.
And I think that's, a lot of what we see with TeamSTEPPS, that people can use them for any number of things. I did a lot of work moving metrics. Did we use every single TeamSTEPPS tool? No.
Right.
We picked the things that worked. And I'm glad to see the responses from people as they do seem to agree for the most part. And I think in any individual organization, they may know what works. Maybe they've introduced some of the TeamSTEPPS tool, not all of them, they want to use that. I think we could go through every tool and find a use for it for just culture or for an initiative, but I think it's a great idea if people personalize.
Yeah, I'm loving some of the chats coming in. Some of the ideas are really great.
Yep.
We are at the top of the hour. So I wanted to tell everybody that if you sent in a question, we are going to definitely get those questions over to both Lynn and Ronnie, and so they can answer it, and we'll get back to you with the answer to the questions, just because I understand that, we said we'd answer them, but we are here at the top of the hour, and I really, really loved getting the depth and richness of your presentation. So thank you both for that today.
Well, thank you for allowing us, and thank you to the audience for the questions that we'll get back to, and these responses coming in are really wonderful. And Ross, if you're still on the line, hi from New York.
And I would love to have everybody do a evaluation too. You'll be seeing that coming in your email if you registered. So sounds good. Thank you, everybody.
Thank you,
Thank
everybody.
you.
Happy
Happy
holidays.
holidays.
Ladies and gentlemen, this concludes today's presentation. You may now log off the webinar and disconnect your phone lines.